And you should consider adding Arabic language to the subtitles, by the way.
It's true. It's true. You know what? Maybe for yours, I will ask Soraya to do subtitles in Arabic because
I'm
she.
sending lots of love to the whole SoftFil team at Prelinium, and especially for Thoraya and Adriana, because they do have an Arabic roots.
So I'm sure a lot of you are familiar with Dr. Noury Adel. I just wanted to quickly tell you a bit more about him. He is an oral and maxillofacial surgeon with 11 years of experience in non-surgical aesthetics. He is a leading aesthetic injector in Egypt, and he's also a speaker and a trainer for various training programs, conferences, and webinars. He's been a SoftFil Academy expert for 2 years now, and he's also known for his contribution to scientific research and his publications in local and international journals. He's always publishing something. I think he never sleeps, to tell you the truth. A lot
About
of
that.
you may know him for his creation of the 3-point tips technique. That was the object of a first webinar last year with Dr. Noury Adel. So if you're curious, you can check it out on SoftFil Academy's website. And today he will present his chin technique. So I will now give you the floor, Dr. Adel, and thank you so much again for sharing your technique and your insights with us tonight.
The pleasure is all mine, and I would like to thank you again, Hannah, for inviting me. And I'm going to speak about my 3-point chin filler technique using the cannula. And luckily, it's going to be published at the PRS Global Open. It should be visible, I guess, by next month. So first of all, when we first started doing facial aesthetics, they taught us the rule of third and the rule of fifth when it comes to the ideal facial proportions. And as you can see, whenever you have a retruded chin or any disharmony between the maxilla and the mandible, you can easily spot it in the patients. That is why it's very important to understand how much a chin can have an impact or an effect on the overall facial proportions. And as they all taught us when we first started in facial aesthetics, you should always adjust your chin in proportions with the lips and the nose. And for me, first tone is the best analysis because the subnasal is always a fixed point. But what we commonly do in our clinic is the E line, the rickets line. But again, I will stick to the first tone analysis. As you can see, it's very important to understand that we should always adjust and harmonize everything with each other regarding the subunits of the face, because now we are starting to see those weird trends like the witch chin. And I call those procedures the Halloween procedures because our aim is to beautify our patients. It's not our aim to do any disfigurement to our patients. Moreover, there are starting to appear a very weird trends in the lips, like the Luran strips lips or the butterfly lips, and they do lip tapping. They even dissolve the old filler and they would re-inject another filler at the same session after dissolving, and they would place those plastic tape to tape the lips. And they actually call it the Michelangelo. I'm sure that the guy have nothing to do with this. He is resting in his grave. So it's very important to understand that the social media does have an impact. I'm not very fond of those techniques. I think this is totally against our role and our objective as aesthetic providers. And nowadays, I'm starting to do different techniques regarding the lips. I'm not heading toward a volumization for some patients who have an acceptable lip proportions. I'm starting to think about the using of non-cross-linked hyaluronic acid for the lips, which is a purely hyaluronic acid skin booster. Remember, this treatment is not gonna give any volume. It is just aims for removing the wrinkles and the fissure in the lips at the picture that you can see. And this is one of the researches that I published about the use of hyaluronic acid skin booster for the lips. It's a purely therapeutic approach. As you can see, the fissures and cracks have been eliminated, and the lip does have a better texture at the picture in the bottom. Remember, no volumization. It is just a purely therapeutic treatment. You can use Revan as pure if you are going to speak about the range of fillers that we do have like today, or any non-cross-linked hyaluronic acid skin booster. Moreover, I'm also starting to investigate the use of polynucleotide in the lips, again, as a skin booster to provide hydration. They are not going to give any volume. It's not for augmentation. In this patient, I injected a polynucleotide, which is the Rajuran, if we are allowed to mention brands. In the lips, it is aiming for hydration. It's not going to give any volume. And in this patient, I did a 4-point technique. So basically, I did an entry point here, and an entry point here, and one here at this lower lip tubercle, and one on the other side. Then I started advancing my cannula to inject the polynucleotide in the lips. So 4 points of entry to do a cannula technique. I ruined my lips actually, so anyway. So this is the 4-point technique for the lips. It's a cannula technique, and I place a micro alipod in each lip tubercle, aiming for hydration. But again, today I'm not going to speak about lips. We are going to speak about chin filler. It's well known that most of us use needles for the chin, but really you should think about this because there is always a possibility of doing a vascular occlusion for the chin, or worse, to have a tongue occlusion. And it's very important to understand that the use of ultrasound, experience, the knowledge about anatomy is very important to avoid those complications. And you know what? There is always anatomical variation, so it can be easily happen to anyone. I know it's a quite bit rare, but you should understand that there's a possibility of having a tongue VO, especially that you do have a connection with the sublingual and the mental arteries, and sometimes you do have a median lingual foramen, median or midline lingual canal, where you could have easily a vascular occlusion with the injections at the midline of the chin, because they taught us that injections at the midline of the chin is super safe. So you should really think about this. So that's why we started to use cannula, because it is safer. You are not going to cause a vascular occlusion with cannula. It could happen, but again, the risk is pretty much lower. But there's an issue with the cannula, because when you do a single entry point from the chin, or you come from the lateral side to the chin, you can give an augmentation, but there is not that much of an artistry using the cannula. I can't draw the chin. I cannot, play with with this area. I cannot hide this shadow with the single point. I will have also to place filler here. So again, using cannulas in the chin, the single point, is not that much of a benefit in terms of artistry. So this is why I came up with the 3-point chin. I started to think, how can I do a technique that provides safety with the cannula? And at the same time, how can I achieve an artistry using the cannula? Because you know what? Using cannula in the lips, chin, and the nose is safe somehow, but it doesn't provide artistry. So this is why I came up with my 3-point for the lips and 3-point for the chin. And I'm starting to think about new ways of doing the nose with the cannula. So this is the outline for the injection. The first thing I do is that I mark the midline of my patient. Then I start to draw the outline of my injection. For a female chin, I will draw 2 vertical lines running from the eyelid downward. If he's a male patient, I would draw the line from the corner of the mouth, because I want the chin of my male patient to be a little bit more wider than my female patient. So it's a 3 points and a 3 steps. The first step, I'm gonna do a 3 entry points. I'm gonna place a single entry point at the pogonian, which is the most anterior part of the chin. Then I'm gonna place a second entry point at the menton, which is the most inferior part of the chin. And my third entry point will be right at the midline of the labiomental crease. Okay, so 3 entry points for my cannula. At those 3 entry points, I'm gonna place a microboluses at each point, followed by entering the cannula to do a superficial threading in this area. So I did 3 deep injections, then superficial injections with my cannula from the same 3 entry points. One of the things that you can do is this, the point at the labiomental crease, you can use it to access the lower lip, and you can use it to inject at the corners of the lips to help in providing a little bit of the lift for the corner of the mouth and to provide a myomodulation. Eventually, I will do the blending to blend everything because it doesn't make any sense to give a beautiful chin without connecting it to the jawline of the patient. So this is the first video. It demonstrates how I do the injection. This is, I'm using Revanes Versa. By the way, this is the product in the US, but if you are practicing in Europe, it will be Revanes Ultra. This is my first entry point. I'm using a 23 gauge cannula. This is the second entry point. Again, all of this is a supraperiosteal microboluses, deep injections right on the bone. Now I am doing the injection superficial from the labiomental crease. I'm accessing the lower lip tubercles. I gave a microbolus at this tubercle and another microbolus at the other tubercle. I'm heading to the corner of the mouth because I want to lift the corner of the mouth. Now I'm doing the blending. I'm connecting my chin to the jawline. I'm gonna show other videos with a better illustration, but I'm just trying to make you memorize how to do the technique. It's super simple. I'm checking the refill right now, and I'm gonna check her tongue also. This is her before and after. So we gave a very natural results. I was able to enhance the chin, and at the same time, we provided artistry. And there's something very important that I want you to see. The corners here is lifted and the shadow at this area have disappeared. Another picture for her from the front view. Another from the side view. This is another patient. Why did it close? Oh, Hannah, what happened?
I'm not sure, Noury. Maybe try it again. Maybe put it not in full screen to...
Okay, let
Yeah.
me see. Oh, okay.
All right. Okay.
So this is again my first entry point. But here I didn't need to inject at the labiomental crease, so I did my entry point for the lower lip right at the midline. By the way, in the Middle East, we love big lips, you know, because aesthetic treatments are costly, so the patient want to feel that you did something at the end of the day. Those are another before and after patients, as you can see, treated with the same technique. And the patient on the left, because she does have an African ethnicity, it was a very difficult case because she already have a large chin. So in order to harmonize everything without elongating the face, it's kind of difficult. I also treated her temple and cheeks and the chin. And the other patient, she only had her chin treatment. So now I'm going to close my camera and I'm going to show you a long injection demo video so you can better correlate everything.
Hello everyone. So today I have my patient, Noury. She's 39 years old and she's complaining from a receded chin. As you can see from the side view, she does have a retrognathia in her chin, so we need to adjust this to do a profiloplasty. She also had a previous lip filler treatment and resolved with ILAs. This was like 3 weeks ago, right? Okay, perfect. So today we're going to do her lips and we're going to do her chin. I'm using Revenus filter for the chin and Revenus kiss for the lips. So let's first start with drawing the outline for my injection. So right now I'm going to do the outline for the ideal female chin injection. I'm going to draw a line running vertically from the ala of the nose downward and another line from the other ala. Now I'm going to go over the midline because I want everything to be completely symmetrical. Now I'm going to treat her with my 3 points chin technique using a multi-layered approach. The first point is going to be at the pugonian, which is the most anterior point at the chin. My second point will be at the menton, which is the most inferior point of the chin. And my third point is going to be at the labial mental crease, right at the midline, which is supposed to be right here. So this is the name of the technique, 3 points chin. Those 3 points is going to be my entry point for the cannula to do first a supraperiosteal boluses or microaliquots. Then I'm going to start doing the superficial layering. Then I'm going to blend everything. Okay? So Courtney is fully enough. I injected her with lidocaine. I add the mental foramina, extraoral and bilateral, and I gave also an anesthesia right at the midline of the chin. Now I'm gonna wipe everything. I like to use betadine, but you can use chlorhexidine, you can use diluted sodium hypochlorite. My first one. This is my second point. And this is my third point, creatability mental peace. Usually it bleeds a lot in this area, but hopefully, let's see what's gonna happen. I'm gonna first start my injection by injection at the pugonian. I'm gonna pinch the tissue. I'm resting on bone. I'm gonna pinch the mentalis. And I'm gonna do an aspiration. I know I'm working with the cannula and it's supposed to be safer than using a needle. Now I'm gonna go for my second injection at the menton. Right now I'm at the inferior border of the chin. I'm doing again aspiration. I'm going to inject my third point. The thing I do is that I always check the refill. Normal. So right now we use the whole syringe of Ravenous Ultra. I'm gonna switch to Ravenous Kiss because I want to head toward the lips to do a little bit of lip purification. So I'm well known with my 3-point lip technique. I do an entry point right at the right GK point and another entry point at the left GK point and one entry point right at the midline of the lower lip. But since I already created a point with a labimental crease, I'm gonna use it to do the lower lip, avoid to do another poke in the lip itself. So I'm gonna do it. Here, I'm right at the lower lip tip. Can you see the shadow of my cannula? I'm gonna do an aspiration. And I'm gonna give a micro dose. I'm gonna have to work the corner of the mouth. I wanna give a little bit of a lifting and also do a little bit of myomodulation. I'm gonna do the same for the other side. Now I finished the lower lip. I'm gonna do the upper lip, but I have to do an entry point for the upper lip. Pretty sure. I'm tapping on my lips because I wanna build this vermilion height. You can already notice the difference right here. I'm gonna start going a little bit more lateral.
Hello, Dr. Noury.
We are watching you in getting injected, Yamuna.
Yeah. I just opened and realized this. I want to. Can I close now the cam, or I should open it from now?
Yeah,
I
sure.
want to just hold the يعني عايز احط
I have
ثواني
exactly like 3 minutes. 3 minutes.
So we finished our session. Mona, please let me know your opinion. Okay, so we adjusted her chin. Now everything in terms of the profile evidence looks pretty awesome. And we did her lips, zero bruising, zero complications. So this is what you get when you work with a good product and with the proper gauge of the cannula. Thank you.
From falling down again. Rise up. Long time I broke the chains. I tried to fly a wide so high, direction sky. I tried to fly a wide so high, direction sky. A dream is to fly.
Hannah, are you here?
Yes, I'm here.
Okay, could you open your camera? And Mona, you are flipped. I don't know why is your camera like this. So for those of you who doesn't know, Dr. Mona, she used to be my professor at the Faculty of Oral and Dental Medicine when I was a student. She's lecturer of oral and maxillofacial radiology. And she was my tutor one day, and now she's my patient. So hard work pays off at the end. I just asked her if she could give us like an honest feedback after her treatment. Mona, your camera is flipped like this.
Really?
Perfect.
I
Yeah.
was just I don't have I'm just came from work and excuse me.
No, it's fine. Because I just came up with the idea today with Hannah, if you could give us your opinion, your honest opinion, because I want to say something. Dr. Mona, she did had a previous experience with injecting another, we can mention the product, Hannah, right?
Yes.
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 Okay, it was Juvederm Voluma. Exactly.
Juvederm, I think D3 or D4, something.
Okay.
Not volume.
She did had a previous experience with other fillers, and I'm gonna show you her before, but when I come up with the rest of my presentation. But usually when you have an old filler and you want to hyalase it and you want to inject another filler, you tend to have a lot of swelling, and because of the compromised lymphatic drainage, it's not that easy to treat patients who had a previous filler treatment from the psychological part and from the clinical part. So I want you to tell me your opinion. We used Ravenous Ultra for the chin and Ravenous Kiss for the lips. We used the same gauge of cannula, the 23 gauge SoftFil cannula. Tell me your opinion, Mona. What did you expect of the treatment?
Yes.
What differences did you notice between the previous
and the first? I'm very grateful that Dr. Noury inject me. Really.
Thank you for trusting me with your faith. It's such an honor.
Yes, I don't trust a lot of doctors really. So I'm very happy and very glad that Dr. Noury inject me one day, and really the experience was amazing, and the pain is less, the swelling, everything, even the feeling. I'm talking maybe first about the lips, because the lips is very sensitive to swelling and while speaking. So the experience was amazing. He's very talented, and the product have a big impact on the swelling and so on. I know I'm not straightforward case. I'm little, and the filler was migrating, but the chin was amazing. I did before a chin, was not with that least amount of material. I got a very beautiful, and usually I'm all the time watching a lot of videos, a lot of doctors. So the experience was amazing, really. And I'm
I
very,
just
very
have a
happy
couple
with
of
the
questions.
results.
Yeah, sorry for interrupting. So the previous treatment you had, you were injected with a needle. Did you feel that cannulas is more painful than needles?
No, the cannula, يعني, I don't know, it's a very, very, very يعني, safe, painless. The feeling, the pain is يعني 70% less pain. The cannula technique really, يعني, really super.
How much did you experience swelling from your previous treatment? Like, how many days did the swelling last when you injected Juvederm and when you injected Revanus?
7 days with Juvederm and bruises, like purple color all around, and a lot of purple colors, very embracing while going to the work and speaking to someone, and you have a purple color here is very but with the other technique, just the swelling 2 days, honestly.
Hannah, do you have any questions for her?
So we talked about the swelling in terms of now. So how long has it been since the injection?
Now, 2 months ago with Dr. Noury.
And Hannah, sorry for interrupting. I want to show you something. If you could look on my presentation, can you see the old filler migrated at the ergotree area here?
Yeah.
And this was a very thick filler. Then I dissolved the filler with a whole vial of Hyalase. It comes at the 1,500 unit. This is after dissolving the second picture, and this is immediately after refilling with Ravenous Kiss for the lips and Ultra for the chin.
Very interesting.
As you can see, this area with the red arrow. And I entered with a 27 gauge cannula. Yeah. I injected the Hyalase at the skin side and at the red part of the lip, because most clinicians will inject the Hyalase only at the red part. So you will not dissolve this part. You will have to go here and there. And I do it with a 27 gauge cannula. I don't use it with the needle. So I interrupted you. Were asking her about something.
No, I was wondering if your feeling, you know, so you felt that there was less swelling, and what about, you know, for how long did you feel, you know, a bit tensed, or, you know, what did you feel after the injection?
No, the amazing part of the story is that there's no tense and this stiffness while speaking. It's completely. I didn't experience with this product, or with, of course, Dr. Noury. I didn't experience this. I know very well what the feeling of that's immovable lips. The lip is fixed while you are speaking, and this give unnatural or weird. I didn't experience, honestly. The feeling of my lips is the movement while speaking is very natural from day one, day two to not in day 2.
So in comparison with the other filler that you got injected, it's really like a nicer, smoother experience.
Yes.
Thank you so much.
Thank you.
Thank you so much, Yamuna. تسلمي لي. ميرسي. شكرا.
العفو. Bye bye.
Bye bye. So let's get back to our presentation. So this is the old filler. Then we dissolved, and after 14 days, we did the refilling for the lips. As I said, I used a 27 gauge cannula for injecting the Hyalase at the skin side and at the red part of the lip. And it's very important to understand that when patients have old filler that lasts for a pretty long time, and then you want to dissolve it and want to do a new filler, please understand that the lymphatic vesicles is compromised, and the swelling is gonna be more. So go easy on them, do baby steps. I'm gonna even do a retouch for Mona for the latter part of her lips, but it should be a slow process. This is the old filler location. Again, this is another case using my 3-point chin, a multi-layered approach. I treated the temples, the cheek, the under eye, the lips, and the chin. So there's something that is very interesting with the multi-layered approach. So when they first taught us facial aesthetics, we were taught to always inject deep because to target the deep fat compartment. But with time, we started to address both superficial and deep fat compartment. There's something that I noticed. When you do the subdermal approach for the temples, in some patients, you tend to have an alopecia because the filler would do a compression on the blood vessels and will affect the hair follicle. The same thing could happen in the male chin, like this patient, for example. When we do a multi-layered filler treatment with the chin, sometimes the superficial filler may affect the microvasculature heading toward the hair follicle. Honestly speaking, I don't know why some patients may have this and other patient may doesn't experience it. There are lots of things that we still need to investigate, but this is something that you should put in your mind that sometimes superficial injection may affect the hair follicles. So this is my Facebook and Instagram and email. Anyone who want to contact me, feel free to. And if case you came to Cairo, just pass by my clinic and say hi. And this is a very short video showing my country.
اكتشف بلدك التانية من أول وجديد.
Thank you, SoftFil Academy, for having me. Thank you so much, Hannah. And thank
Thank
you for
you.
the picture, by the way. We took it at the Preliminary Masterclass. Do you remember?
Yes, and I love this picture.
Yes. And now the question and answers.
I loved this video. Now I want to travel to Egypt.
Yeah, we will make a SoftFil tour.
Yes, that would be amazing.
How can I
Thank
close
you.
my presentation? Okay.
Yes, now you can.
Okay. So now
So basically, if there is any question, please ask your questions in your Q&R or in the chat. If you have questions about the cannulas, the fillers, the technique of Dr. Noury Adel, please don't hesitate. He's here to answer anything that you might need. If you can just repeat.
I have a question for you, Anna, by the way. How can I see the questions?
Sorry?
How can I see the question? I opened the webinar chat. So in your online platform, you upload lots of tutorials for injections at different areas of the face. How do you do the chin? Like you enter from here or from the lateral part?
No, from here. That's what I know.
Okay. Because this is what I saw Dr. Sandrine doing.
Yes.
I love her injection techniques, of course. But we always have the issue with the single point, like you augment, but you will give this protrusion, but you cannot give the downward growth. You cannot play in this area. So that is why I came up with the 3 points. The same thing with the lips. When you enter from the corner of the mouth, you augment the lips, but you cannot draw it. So you should not blame the cannula. You should think about how I can use this tool to draw with the face, you know?
No, it's very interesting, and it's true that Dr. Sobanche is used to injecting from this entry point for the chin, and I'm sure she would be very interested to hear about your technique. You should discuss about it with her.
So Rhonda have a question. Do you only use cannula for the lips? Yes, Rhonda. I don't know if I'm spelling the name right or not, but I always use cannula. There was a time where I would use the needles that come with the filler syringe. Then I started using the PD insulin syringe. I would load it with the filler and I would use it. But nowadays, since I came up with my 3-point technique, I always do a cannula. If the patient want to have a big lips and want to have an artistry and accentuating the lips, I would do a 3-point. If you just want to have a very subtle, just the corners. And I'm going to say it again for those of you who might not know it. So I do an entry point here at the tip of the Cupid bow on the right side, another one on the left side, and one at the midline of the lower lip. Then I would use those entry points to advance my cannula to inject in the lips. I'm lucky that I do have a pink lips, Hannah, because you can easily see the white part. If I was a smoker or a heavy coffee drinker, it would be a bit darker. So yeah, I always use cannulas. What is the gauge and length of the cannula? This is an anonymous. Okay, gauge and length of the cannula in the chin. So I always use a 22 gauge, but to be honest, I was always founded by how Dr. Sandrine used the 23 gauge, the navy blue one. And it's pretty short because I will tell you, unfortunately, most cannulas come in a very long length. So you would have like to place it here or place it. Part of the cannula will be resting on the patient face, and it's not convenient during using it. So the short one, the 23 gauge, 30 millimeter cannula is the best so far for the lips, for the chin, for the under eye. But for the cheeks, I would prefer a longer length. So I guess it's perfect, actually.
We have another question about the highlights that you use to dissolve and the quantities that you use. Can you maybe talk again about the quantities that you're using when you dissolve?
So, Amir, you said we don't have recombinant hyalase in Canada. Oh, we don't have recombinant hyalinex in Egypt too. Okay, so we only use the hyalase. It comes at 1,500 units. I would use a 2 ml saline for stubborn old fillers like my beautiful patient here. I will use a 2 ml saline for reconstitution. I will inject the whole vial. This is what I do in my clinical practice. I discovered that when you use a very short hyalase, the patient tend that you should bring it after 10 or 14 days to do another session of hyalase. But when you inject the whole vial, the skin side on the right part, you don't have this problem. And I want to add something. The Hyalinex, it comes as a liquid form recombinant DNA technology, but the hyalase comes from bovine or ovine, so it should have an allergy to do an intradermal skin test. Christina, thank you, Christina. I live in France. Okay, I want to live there with you one day. And Revanesse is not available. But Revanesse is not available. Is it okay if I use a medium? How come that Revanesse is not available in France?
Revanesse will be available in France from September, just so you know. So it's coming very soon.
Okay. So Christina, when it is there, you should bring it. But is it okay if I use a medium filler for the chin? Okay. So I'm just going to answer your question since you don't have another alternative so far. So you can use, if you are using like Galderma, you can use Restylane Define. The RHA range is good too. But what I really found in Revanesse Ultra is that the patient almost like have no swelling, as she said, on the follow-up sessions, like what you inject, what you get. And in the video, Hannah, I used only Ultra, but in some cases, I may use the heaviest G prime right on the bone, and I will use Ultra superficial if the patient have a severe retrognathia. Like I would use Revanesse shape on the bone and Ultra superficial. But if the case, doesn't need this much of augmentation, Ultra can work best for both.
Thank you.
I'm a beginner. Can I know if I can make taxes by cannula? Taxes, the jawline definition. I really hate those commercial terms, but anyway, So you can use it with the cannula, and actually using the cannula for the jawline is perfect. You can do it in different ways. So you could do an entry point here, right at the gonial angle, and a superficial thread here, and a superficial thread here. This is a way to do it. There is another way you could approach from here, heading toward the angle of the mandible. Or you could do an entry point here and enter with the cannula to give a bolus on the bone, to give a projection, then superficial at those parts. And I want to add something, Hannah. Recently, they found that deep injections along the jawline, the filler end up in the parotid gland. So we are starting to think about doing the whole area superficially, you know? And especially when fillers migrate at this mass, it tends to have a high rate of causing a delayed onset inflammatory nodule. So we are starting to rethink about how we approach different areas. But of course, you can make the taxes with the cannula. Is Revanus Ultra also good for the lips? Yeah, it is good, but Revanus Kiss is somehow more fit to the area. Revanus Ultra is good for the lips, but sometimes it's gonna be hard. So I would use Revanus lips. If you are experienced injector, you can use it, because we cannot deny that sometimes in our clinics we inject high G prime fillers for the lips, because it's gonna last for a long time and it's gonna give the volume that I want. But you should be an experienced injector, because you don't want the lips to be lumpy or heavy or have any sort of complication.
All right, I think we're done with the questions. Thank you so much, Noury, again, for this wonderful webinar. It was really interesting, really interesting technique.
I'm sorry, Hannah, it's gonna be published at the PRS in top accepted. And but right now it's gonna be proofreading at the journal itself, and I'm gonna post it on my social media once it is published. So this was a good thing, the webinar, to correlate the webinar with the scientific research.
Amazing. We are looking forward to seeing the publication, and thank you again so much for your time and for sharing with everyone. The webinar will be broadcasted from tomorrow. The replay will be broadcasted from tomorrow on SoftFil Academy's website, and again it will be subtitled in French, in Spanish, and we will negotiate with Soraya to have it in Arabic as well. And have a good evening, everyone, and we will see you for the next webinar. Thank you, Dr. Adel. Thank you so much.
Bye-bye.